folks. Back again with Jeremy with the hospital PT, and we're going to continue our discussion about assistive equipment. Okay, and again, we're going to cover a piece of equipment that has a place. All much like exercise or exercises, there is no one size fits all. Either this is always good, always bad, and so on and so forth. Okay, so with this particular piece of equipment, there are appropriate uses for it. We will cover some of those appropriate uses for it, but more of what I want to cover is the inappropriate use of motorized wheelchairs. Motorized wheelchairs. Okay. Now, if you can imagine, I'll just ask a question. Okay, what do you think the primary reason for the use of a motorized wheelchair is? Okay, take a minute, think about it. It's not that complicated or that difficult. It makes moving around very convenient. Okay, it's basically a vehicle. Okay, for inside the home, and I, as a physical therapist, have an issue with them because they often are utilized too early in patients' recovery or rehab journeys. Okay, and it happens with the best of intentions. Many families, they say, oh, you know, it's difficult for mom to get out and go to church. It's difficult for dad to go have breakfast with his friends at the local coffee shop or what have you. Okay, and the motorized wheelchair makes that much more convenient, much more feasible. And while that's true, you have to ask, what is the unintended consequence of making a move towards the use of one too quickly? And the answer that I will give you is that it facilitates deconditioning and debility in the long term. Okay, probably a month and a half ago or so, I made a similar video about the use of lift recliners and things. And so this is very similar to that video in that the inappropriate use of a motorized wheelchair often facilitates increased weakness, debility, and deconditioning that often leads to poor quality of life. When how they're marketed, specifically the motorized wheelchairs, they're marketed as improving a quality of life, and that might be the case for the very short term. Okay, but most of the time, most patients would benefit from doing more things that are difficult. Of course, we need to be safe when we do that. Okay, of course, we need to do it in a feasible way that allows them to safely regain strength, function, and so on and so forth. And that's why professions like physical therapy exist. Okay, the issue is that there needs to be a compounding effect of strength training. If the home health physical therapist comes to see you or your loved one twice a week to do progressive exercise, but the rest of the week you utilize the motorized wheelchair to do 95% of your mobility, it's going to be hard to recover the strength and the mobility that you've lost, if that's the case. Okay, so I'd like folks to be mindful of overutilization of motorized wheelchairs and pushing the use of them down the road farther. Okay, and instead engaging in activity regularly that is difficult and that does make you uncomfortable. Okay, so yes, it is not pleasant to get out of breath when you walk from your living room to the bathroom. But if you can do it, you need to do it as long as you can, even if it's difficult. And the way that you get better and get, to the point where simple things like that are not difficult is not by doing less. It's by pushing beyond what you currently find difficult. Okay, that's just a general strength training principle. You must progress the intensity of the exercise so that what your current capacity is eventually becomes easy. Okay, and I'm not trying to be cryptic when I say that, but if you currently can only walk 50 feet, then you need to get to the point where you walk 50 feet multiple times in a row with only a little bit of rest in between. And yes, by the third or fourth time you walk 50 feet, you may be very, very tired, and you may be sore, you may be out of breath, and all of those things, and that is uncomfortable. The issue is that we must undergo a type of voluntary difficulty in order to regain the strength and mobility and conditioning that we desire. Okay, Father Time is not kind to any of us. Okay, and if you add in an injury or an illness to that, it makes moving around and regaining your mobility and strength very difficult, and it's time intensive. One of the things we tell patients in the hospital, and it's hard. There's no significant data on this, that is very, quantifiably articulated. Okay, for every day that you're on bed rest, it takes about 3 days of activity to recover from that one day, and we intuitively know this. Okay, we intuitively know this because if you get the flu and you're down for 3, 5, 6 days or something like that, even though you start feeling better, you cannot immediately the next day, after you're not running fever and you don't have body aches or anything like that, you can't immediately go back to the same level of activity that you were engaging in prior to getting the flu. It takes you a little while to feel like you're back up to speed where you were prior to getting sick. Okay, add in a critical illness to that, and critical, what we call myopathy. So your muscles get affected by being critically ill, and now you find yourself at home. Guys, it's uncomfortable and it's difficult. Recovering from a significant illness or hospitalization is not for the faint of heart. It really isn't. You can liken it to training for an athletic competition, if you want to think about it like that. Okay, it takes a similar amount of dedication and endurance and perseverance to climb out of the hole that you may find yourself in after being hospitalized. It can be done, and we people like myself help patients get on the road to that. Okay, but what we see sometimes is patients start the rehab process, okay, in the hospital, and they're making progress, and we're getting them out of the bed, we're getting them on their feet, we're walking, and so on and so forth, and they go home to get home health physical therapy, and their family says, hey, maybe we need to use a motorized wheelchair, and they intend to only use it every once in a while, but all of a sudden, every once in a while, it turns into, well, I'm going to use it 3 times a week. Now I'm going to use it, when I get tired during the day. And there starts to be this justification that happens. And all of a sudden, now they're relying on the use of a motorized wheelchair when they maybe had the capacity to regain more and more mobility, but they short-circuited that by the use of a motorized wheelchair too soon and then too often. Okay, so now, what are the appropriate uses of it? Guys, if somebody if this is the last ditch effort to allow them to maintain some level of ability to get out of their home and to maintain some level of mobility, they have, obviously, this seems like a duh statement, but I'll say it. If they've incurred amputations, either both feet have an amputation or the part of one foot and the lower leg of another leg or something like that. Obviously, those become and for whatever reason, the use of a prosthesis or being fit for a prosthesis isn't feasible because they have wounds that won't heal and so on and so forth. The more medically complex they are, that the more irons they have in that particular fire, the more appropriate the use of advanced assistive equipment is. Okay, other types of medical illnesses, right? The use of, like, say, advanced multiple sclerosis. Okay, this patient has been dealing with multiple sclerosis for years, and the illness, unfortunately, has just really taken a toll on them over the course of 15, 25 years or something like that. And their only means of mobility, the only means possible, is the use of a motorized wheelchair. Then certainly those are the appropriate uses of them. Okay. So like I said earlier in the video, I'm not I'm going to throw the baby out with the bathwater and they should never be used. I'm not saying that. I'm simply saying that they don't need to be used too soon and too often if it can be helped. Okay, I see that all of the time in the hospital, and then what ends up happening is more debility, more deconditioning, and dependence on the motorized wheelchair happens, and then now you start to run you are at increased risk for other issues. Okay, wounds on your backside and legs, increased cardiovascular risk because you're not moving around very much, increased risk for pneumonia because you're not moving around very much, and so on and so forth. The list goes on and on. Okay, so the simple takeaway from this video is, while they have their applications and uses, it should be your desire to prolong the use of a motorized wheelchair as long as you possibly can for either yourself or your loved one, and do the hard work of rehab. Okay, there is payoff, and yes, it's slow. It can be slow, but maintaining your mobility and independence and doing as much as you can for as long as you can, that's how we increase our quality of life. Okay, that's how we increase one way and one aspect of maintaining a quality of life that allows you to interact more fully with in your family, at home, with your environment, with your community. Okay, so that's just something to keep in you guys' back pocket as you're find yourself trying to recover from an illness or helping a loved one recover from an illness. Encourage them, and I'm here to encourage you to do the hard work of rehab. Okay, it's worth it. I know I'm biased, and you probably have heard from other physical therapists like myself. Sometimes we're likened to cheerleaders. So if that keeps somebody moving, if that keeps somebody on their feet and out of wheelchairs, then so be it. Okay, until next time, guys, remember, you can't go wrong getting strong. Stay tuned for more content like this. I'm here to help caregivers and patients be safe at home, know what to expect in a hospital. I have more content coming to you guys, so stay tuned. Until next time, like I said, remember, you can't go wrong getting strong, and we'll see you on the next video.